How many people would still be alive if they only listened to their bodies, to signs and symptoms that our body is always making and telling us that there's an emergency, something we should be paying attention to and visiting the doctor, calling 911, or doing something urgent in order to survive? Today, I'm going to reveal to you what symptoms and signs you should be very aware of that are telling you that something is not right, that you might be just on the verge of death and needs to be attended to before things get out of control. So in today's video, I'm going to tell you exactly what to do if you see any of the signs that are telling you that there's an emergency happening and that you need to go to the hospital or visit a doctor. Most people who end up in the emergency room almost didn't go. They thought it was just stress or just indigestion, just a headache, it's nothing serious. But the reality is that this sign and symptom is something that happens to most people, not all, that are going through something very important that needs attention. The heart, maybe a stroke, maybe a problem with a coagulation in your circulation, something that has to do with your brain, a headache, a sign of feeling tired all the time. These are all symptoms that might be indicating you need to go urgently to that emergency room and get some attention. But before I continue, please make sure to subscribe to this channel, press that like and notification button, and make sure to leave your comment or question if you have any of the symptoms that I'm going to mention to you in this video. Make sure to subscribe and press that like button. I really do appreciate it, and it really does help the algorithm. So having said that, let's go ahead and continue. Number one, if you have a toothache, you might need an urgent medical attention. This is something that everybody thinks is normal, having a toothache, maybe and especially on the left side of your jaw, or maybe your jaw is hurting or your neck is hurting. Anything that has to do with the left side of your face could be a sign or a symptom of a heart attack. It could be something that's indicating that your heart is going through a stressful situation, maybe a clogged artery, maybe high blood pressure, maybe something that is just damaging your heart or going through that stroke that you have no idea is happening in your system, and you really need to pay attention to it or get some medical attention fast before you go through a heart attack and then things really get messy. Just so you know and understand why your jaw is hurting, our nerves are all connected, and this is a pain that is radiating from your heart directly onto the left side of your body. It could also mean there's a pulmonary embolism, maybe an aortic dissection, or a heart attack. Any of these conditions is really serious, so it's a sign and symptom you should not ignore. If you need something natural to improve circulation and keep your heart healthy, look for Heart Excel, Garlic Gold, On Cardio, and Berbrain from Fineland at FinelandVitamins.com. Number two, a sign of a stroke. When you're having a stroke, there are many symptoms that call or will call your attention. Something that is not common that might be happening usually during the morning after you have breakfast or right after you get out of bed. It could be your face dropping, your arm maybe feeling weak. Also, it always has to do with one side of your body and not your entire system, not symmetrical, not both sides, okay? You might see slurred speech, sudden confusion, or maybe sudden vision problems. These are all critical, very important that you get attention as soon as possible, because the more you wait, the more dangerous it could be. You see, a stroke happens usually when you get a small coagulation effect on a very small artery of your brain. It just clogs it entirely, and you need to go to emergency room to take that out before the entire part of that brain that is functioning to keep you healthy or to keep your movement on your face and what you're feeling is entirely dying off. The faster you get there, the faster you get to surgery, the easier it will be to get back your motility. If you wait more than 1 hour, 2 hours, 3 hours, then things get just a little bit more messy than you want them. It's just a lot harder to get those functions back, and some people even end up in a wheelchair because they thought about going to the doctor or calling 911 when they saw slurred speech, but they did not do anything about it, and now they're living their life the way they didn't mean to. Look for something that can help you with circulation, something that can keep you healthy in your brain, something like Neuroflex, Berbrain, Neuromatrix, or even Garlic Gold and Antioxy Pro from Fineland at FinelandVitamins.com. Number three, a severe headache needs medical attention. Headaches are common. Yes, they are. But they usually appear slowly and they grow as hours or days go by. This is normal. Now, if you're feeling a headache that just comes out of nowhere with an explosive onset, with neck stiffness, with vomiting or confusion, hey, this is serious and you need to run to get that medical attention. This could be a signal of brain bleed, maybe an aneurysm rupture, maybe even something that is going on with a tumor that's growing is gone out of control. No one knows what is happening until you get some medical attention, you get some tests done and see what's happening and what's going on. So remember, if you feel that headache that was the worst headache of your life that you were not counting on, you need to go to the doctor, and fast is not enough. Number 4, fainting or the loss of consciousness. Having a loss of consciousness or fainting is not normal, obviously, especially if there's no warning, if it happens during an exertion or some type of stress, or if it's accompanied by chest pain or palpitations. Then you need to be very aware that this may be indicating that the heart rhythms are not constant. You might be seeing high blood pressure, maybe you might be seeing low sugar levels or high sugar levels. You don't really know. Nobody does. You need some lab tests run. You need to see what's going on in order for us to understand why you are having that loss of consciousness without fainting. In any case, it's something that needs medical attention and needs it fast enough. Look for something that can help you with circulation, something that can help you keep you healthy with your hormones, your thyroid, etc., like metathyroid, Appalizer, metaglucose for glucose, and even Heart Excel or On Cardio from Fineland at finelandvitamins.com. Number 5, feeling always tired. Feeling always tired is not normal. It may not be an emergency. It might be something you're going through for the longest period of time, but this is something serious. Why? Because you might be, or your metabolism might not be working well. You might have a thyroid condition. You might have a glucose metabolic condition that you're not aware of. You might have insulin resistance. You might even have diabetes or low blood pressure. You might have many things and you're not even aware of them. In order for you to fix them, you need to know what's happening. And believe it or not, this feeling tired is a lot more common than you might think. Might be obesity, might be diabetes, might be... In any case, it's the base of thousands of other conditions that later down the road, you might even discover that you have, but you could have prevented it if you had listened to this video. Look for something like Appalizer, Metathyroid, Neuromatrix, 5-HTP, or even CurQ Health from Fineland at finelandvitamins.com. Don't forget to give us a like button, don't forget to share, and I'll see you in the next video. Take care.